What's really important for more and more lactation consultants to recognize is that it's not just about no pain and good weight gain. Breastfeeding is the foundation for good oral muscle development as well as jaw development. And so really understanding those mechanical benefits and the importance of getting good mechanics, good latching, and good tongue function.
I'm Jamie Zaki, IBCLC and Mama 5, and this is the Breastfeeding with Confidence podcast, where pregnant and new mothers learn how to prepare for and overcome breastfeeding challenges without being controlled by stress, fear, and anxiety. Each week, we'll answer your questions, share breastfeeding success stories, and inspire you to shut out the toxic whispers of the world and embrace your God-given intuition to make confident breastfeeding decisions. Let's dive in. In today's episode of the Breastfeeding with Confidence podcast, we're going to be talking to Dr. Shereen Lim, who is an airway-focused dentist, which means she has a deep understanding of how the facial development impacts the airway. And today we will be talking about how breastfeeding, nursing at the breast specifically, has benefits beyond just the breast milk, but the mechanical benefits of breastfeeding on your baby's facial development and their airway. It's a really interesting conversation, and I think it's a really important conversation. And I am so excited to share this conversation with you today. But first, I wanted to ask you if you could take a quick minute to scroll down and rate and review the podcast. Your feedback helps us make the podcast better. It helps other moms find the podcast and so that they can set themselves up for confident breastfeeding. I'd also like to invite you to go ahead and grab the free 5 Mistakes to Avoid When Breastfeeding guide at littlebearlactation.com/mistakes. That's littlebearlactation.com/MISTAKES. And it is linked in the show notes. There you can learn about the top 5 mistakes that I see new moms making when breastfeeding. And then you'll be able to pick your pathway, whether you are pregnant or postpartum and kind of struggling with breastfeeding, and you will be given more resources based on where you are in your journey. All right, let's get started. We are here with Dr. Shereen Lim, and she is the author of Breathe, Sleep, Thrive. And I am so excited about this book. She sent me a copy, and of course, she has a section about breastfeeding, which is the one that stood out to me. And it talks about some really, really important things. She makes some really great points that I don't think we talk about enough, because sometimes it can be a little touchy and unpopular because it might make us sound mean, and we're not being mean. We're just wanting people to know the facts so they can make informed decisions. So Dr. Lim, could you please introduce yourself? Tell us a little bit about who you are, what you do, and why you do it.
Fantastic. Yeah, no. So thank you, Jamie, for having me. It's an honor to be able to spread more awareness amongst your following. I'm a general dentist from Perth in Western Australia. And about 12 years or so ago, I qualified in dental sleep medicine, really prompted by my husband's snoring. So I became involved in the management of adult snoring and obstructive sleep apnea. And what I started to recognize is that this is a serious condition affecting people's quality of life beyond that noise. And also that it's when we're doing these dental devices to help adults with snoring and sleep apnea, we're really trying to do a Band-Aid solution to compensate for the poor jaw development that's occurred. And we have greater opportunities to promote jaw development early on in life through early interceptive orthodontics, as well as recognizing that form follows function. And so if we have poor jaw development, it really is a symptom of oral dysfunction in the earliest years of life when those jaws are growing most rapidly. So we really need to pay attention to things like tongue ties and the impact on breastfeeding, because breastfeeding is really the number one modifiable factor that can influence jaw development in the peak period of jaw development. And so we want to optimize that early. And that's how I've become more and more involved in early intervention through orthodontics and promoting the mechanical benefits of breastfeeding and managing tongue ties from infancy through to adults.
Yeah, I love that so much. I think, it can become so controversial talking about tongue ties and oral dysfunction. And it's like, oh, is this a fad? Like, what is this? And I think it's just people don't realize we're getting a deeper understanding. For so long, we never looked at root causes. And once we start looking at root causes, it really brings us back to the beginning. And I would say that that's true on all health conditions, all chronic and long-term health conditions that we see in older populations, I think can be traced back to breastfeeding. And I don't want to put too much. I don't want to act like it's an all or nothing, but at the same time, I mean, we have an entire
2 generations, maybe 3 generations of human beings that were not breastfed. And now we're having all these issues that we're saying are normal because everybody has it. And what if it's not normal? And what if it is connected to breastfeeding? Like you said, it's a modifiable factor. That's something we can fix and change. We can make sure more babies are breastfed. So looking at your book, there's a few things I want to talk about in here, but you said one line I highlighted. It says, well-intended professional advice can be a barrier to a good start to breastfeeding. And I think that is just the root of everything I do, because I think so many of us are expecting professional providers to help us navigate breastfeeding. And a lot of their advice is well-meaning, but it's not good. And it leaves a lot of moms struggling. And then you had another statement in here that said, if we want to make mothers feel less guilty, it's not about avoiding promotion of breastfeeding. And this might be a little controversial twist here, but I feel like this kind of comes back to the whole fed is best versus breast is best conversation. It's not about pitting feeding methods against each other. It's about understanding the information and making confident decisions.
Yeah, for sure. I think, what's really important for more and more lactation consultants to recognize is that it's not just about no pain and good weight gain. Breastfeeding is the foundation for good oral muscle development as well as jaw development. And so really understanding those mechanical benefits and the importance of getting good mechanics, good latching and good tongue function. Because if we don't, we get these compensations that play out later down the track.
Yeah, I would totally agree. And I think I see so often that we have these two extremes where it is, on one hand, we're doing releases because we see what we think is its high, or we recognize oral dysfunction and we just go and do a release without actually addressing the function at any point during this process. And then on the other side, I do often hear when I identify oral dysfunction and parents are like, well, she's gaining well and I'm not in pain. And I'm like, I understand that. However, those are not the only two things we care about. Yes, those things are important. And at the end of the day, if you have zero bandwidth for anything, those are the two things I'm going to focus on, right? If you want to breastfeed, we want your baby needs to be gaining weight and you shouldn't be in pain. But we want more for our babies, don't we? Don't we want more for our babies than the bare minimum?
Yeah, I think we need to help parents understand what are the implications and really to understand that, breastfeeding is really the foundation for good tongue function.
So what are the implications of oral dysfunction? Say your baby's gaining weight and you're not in pain, but they have poor oral function. How is that impacting the development of their face, of their airway? What does that play out as down the road?
Yeah, well, one of the common symptoms that gets very overlooked is actually aerophagia, or the excessive intake of air. So even if babies are putting on weight or they seem to be successfully feeding, many parents don't connect that air intake to oral dysfunction or poor swallowing. And so they may get symptoms like resembling reflux-like symptoms. So, they may be very archy or uncomfortable, stomach distension, crying, arching, and really uncomfortable babies. And this gets misdiagnosed often as reflux with babies getting medicated, and there really is no relief. And yet these families are struggling with these babies that are crying. So I think just recognizing that is another important aspect of oral dysfunction that we're overlooking. But in terms of your question with the mechanical benefits, we actually really want breastfeeding to promote good tongue suction. So for efficient transfer of milk, we need the tongue to suction lightly to the roof of the mouth. And then as it drops, it creates a vacuum, and that's how milk is effectively transferred or most efficiently. And when the tongue is doing that, we're promoting good tongue tone, which is necessary for the development of the palate, to broaden the palate, which is really the floor of the nose and the housing for the tongue. So if there is an underdevelopment of that, that will play out down the track as an airflow limitation or increased risk of sleep disturbed breathing. But we need that jaw development to really work well in those, the tongue to work well in those first 6 years of life to promote that good jaw development. Now, when the tongue doesn't work well, we can still feed and we can actually compensate. We can use other muscles, and it alters our swallowing, and we overuse muscles of the lips and the face. And I see this even in children that have speech problems, or those children that have speech therapy for years without getting anywhere. They have a tongue twist, and you can sometimes understand it, but they're actually making the sounds with the wrong muscles.
Yeah.
And when that occurs, what this plays out as is the tongue is not developing that proper tone, and we need the tongue ultimately to rest in the roof of the mouth. And that promotes nasal breathing because it's harder to mouth breathe. It's impossible to mouth breathe when that tongue sits correctly. And it matters most during sleep, because when we're asleep, all the muscles are relaxed. And if that tongue hasn't been working properly, we will have a lower tongue posture, which is associated with more disturbed breathing or airway collapsibility during sleep. So if we don't really address the oral function early on, it will play out during sleep. Really, the bulk of the tongue is formed by the genioglossus, which is the main upper airway dilator muscle keeping the throat open. So it will play out. There are implications down the track. We just don't know when those compensations will reach their capacity for us to function normally. And the other thing that I think I'll quickly mention is that oftentimes we'll use neck muscles if we have a tongue restriction. And that often plays out in the form of neck tension or chronic headaches, which can be quite debilitating, yet no one is really paying attention to this. And people are getting ongoing chiro, massage, acupuncture when this restricted tongue mobility and the compensations have been overlooked.
Yeah, no, I'm just like smiling ear to ear. People can't see this, but it's like you're talking my language. I was kind of laughing to myself while you were saying that, because sometimes it's so stupid, but sometimes my husband and I, like, well, we're like people watching or whatever, and I'll be like, we'll like see somebody from a distance, and I'm like, I bet they have a tongue tie. They didn't breastfeed. And he's like, what are you talking about? And I'm like, just based off how their face is structured, they didn't have that mechanical development. And he's like, you're crazy. And I'm like, no, watch. And sometimes it'll just like even be people we know, like family, friends and stuff. Like we'll be at a party and I'm like, hey, can you like suction your tongue to the roof of your mouth? Let me see. And they're like, no, I feel like I'm choking. And I'm like, or oral dysfunction. And so I'm like always having this conversation with people everywhere, because I'm hearing, stories of like, oh, my child's tonsils are so big and we have no idea why. And they've been in years of speech therapy. And I'm like, well, they're not nasal breathing, they're mouth breathing. There's probably some type of oral dysfunction. You need to talk to somebody other than just your general pediatrician for these things sometimes. So I love all that information you shared. And it brings me to my next question. A lot of people, talk about the benefits of breast milk, and the benefits of breast milk are amazing. But we're not just talking about the benefits of breast milk today. We're talking about the benefits of breastfeeding, actually feeding from the breast. What is the implication then if your baby does have poor oral function and you're like, it's okay, like if breastfeeding doesn't work out, I can just use bottles? Like, what is the impact of bottle feeding on oral function and oral development?
Yeah, well, as I had mentioned before, the breastfeeding really, for efficient transfer of milk, requires the tongue suction. So we're really developing that tongue, which is going to help shape the palate. And the other thing breastfeeding does, it's a complex coordination of muscles that brings that lower jaw back and forth. So it develops the whole face, not just wide, but forward as well. In contrast, a bottle, it doesn't require that coordination. So we don't use orofacial muscles as much or our jaw muscles as much as in our tongue. So when we use a bottle, what we're doing is we're actually placing a non-deformable nipple. It's not as malleable as the breast, and it's actually lowering the tongue position. And we actually increase inward pressures of the lips and cheeks. So the lips and cheeks can do a lot of the work. So it's not as effortful. So it does alter the way that the muscles work. And it also, when we are at the breast, it really coordinates our suck, swallow, and breathe. So we can do all things at the same time. We can really regulate that flow and get our breathing well compared to a bottle, which is easier to come out. And we may have to have pauses in breathing and stops. And this is where mouth breathing begins as well. So it really alters the way that things work. And I think it's important. A lot of people can't breastfeed for different reasons, and I never want to guilt anyone, but it's just really about informing people this is what's actually happening, so people can actually make a fully informed decision. And if they aren't able to do breastfeeding, what are the next steps that can be done as children get older to help your more normal function.
Yeah. And even as your baby's small, if you can't breastfeed or you can't breastfeed 100% of the time because you go to
Mhm.
work, we have so many different options out
Mhm.
there. And if you don't mind, I'll just touch on some of them a little bit is, even if your baby cannot breastfeed because you don't produce enough milk, you can feed at the breast with an at breast supplementer. It's kind of a pain in the butt, but you can still get that oral function and development without your body making enough milk. We can still use supplemental lines and have that development, that function, that experience. If it is a pain thing and I always tell people we need to work on that function. We need to take the steps to work on it. Even if you never get to full breastfeeding, we still need to optimize what we do have.
Mhm.
And I talk about that a lot with optimizing bottle feeding. You might not be able to feed at the breast, but how can we mimic it as much as possible? How can we make the baby work as similarly to the breast as possible using, certain nipple shapes and flows and feeding positions? And so if there's a mom listening, like you said, we're not making you feel guilty for using a bottle. It's just understanding that there are implications and there are options, and breastfeeding really is like a vital sign. I've heard it said before by some people who have trained me and everything, like breastfeeding is a vital sign. And if breastfeeding is not working for one reason or another, it's a red flag to a deeper issue, is what I'm hearing you say. And it can cause deeper issues down the road if you don't catch it early and start working with it early.
Yeah, I think when I first learned that the poor jaw development was a risk factor for the development of obstructive sleep apnea, and then understanding form follows function, what we can say is oral dysfunction is the earliest marker. So if there is breastfeeding problems or difficulties with latching, poor swallowing or intake of air, they're usually the earliest markers that there will be issues down the road. And if we can recognize that, there'll be other avenues that we can do to rectify or get things back on track.
Yeah. And I want to mention too, is sometimes, like you said, in the early days of breastfeeding, we don't have pain, babies gaining weight. So we're kind of ignoring some of these other smaller red flags that maybe we should look at, but we don't. And then they start solids. And I so frequently see when babies are starting solids, that's when a lot of those compensations kind of start to show themselves. And I have moms that are like, oh, my baby, she hates eating solids. Like she just gags all the time. It's like, well, that's a protective mechanism because she's not doing something's not working right. And I had this with my own child, with my second. I told you a little bit about him before we started. Once, like, he was breastfeeding really well, but once he started solids, the thing my mom caught on to was like he's swallowing his food almost whole. Like it's like he's not getting that process of chew, using your tongue to move it around the mouth and then swallow. And she caught on to that. And unfortunately, it was way too long that we waited to really get answers on that. But looking back, you can kind of start to see those pieces come together and you're like, oh, look, we just started layering. And so wherever you do catch it, start fixing it. It doesn't matter if you catch it late. Just when you do catch it, do something about it. Take action. If there is one piece of advice that you want moms to take away from your book or from this podcast episode, what would it be? What would be the one most important thing that you want people to know about sleep disordered breathing and oral function and the airway?
For your particular audience, where we are talking more about breastfeeding, is really recognizing that as good as the immunological and nutritional benefits of breastfeeding are, really there is mechanical benefits that we are yet to properly promote. And really, breastfeeding is the foundation for good oral development, including tongue function. And when that tongue doesn't work well, it will affect the way that the jaws and faces grow well in those first few years of life, and ultimately plays out during breathing and sleep. And this is the earliest developmental milestone that we actually need to pay attention to.
Yeah, I love that. If there are people who want to get your book, is it available on Amazon? I'm going to link it in the show notes. But for people who are listening and don't go into the show notes, Amazon, where else can they find you? Where can they follow you? Where can they find your information?
Yeah, Amazon is the easiest distribution. It's available everywhere, or just Google it. There's so many online sellers that stock it. In terms of social media, where I'm most active is on Facebook, Dr. Shereen Lim. I'll often share cases. Right now, I'm super passionate about creating awareness of the buccal ties, cheek ties, and lower lip
Yeah.
ties. In the last
Yeah.
4.5 months, I have been doing more than ever, just because of the amazing feedback that I've been getting from children and adults. So I really want to highlight that and why I'm paying more attention in infancy. And then Instagram, my website, drShereenLim.com.au.
That's perfect. I will link everything in the show notes. The book is
Yes.
Breathe, Sleep, Thrive by Dr. Shereen Lim. And I might have to have you back another time to talk more about those buccal and lower lip ties, because I know that is kind of a hot topic.
Yeah, I'm just surprised every day. I just listen to my patients and I'm just surprised. You're the same, I'm sure, with tongue ties, some of the
Yeah.
incredible experiences that people are having, but I never really thought of these either.
I
Yeah.
know there's we'll have to connect to have another conversation specifically about that so people can understand. But I know there's a lot of contention in lactation land around buccal ties and lower lip
Mhm.
ties, and providers who don't want to release them because they don't think they're a problem. And so it's definitely, I think, like the new frontier. Like that is kind of the new thing that people are going to start learning more about. And I think there's definitely a lot to watch with the advent of all of that information. And I'm definitely looking forward to hear what you have to say about that. Well, thank you so much for joining me today.
Thank you so much, Jamie, for having me. I think really my other area of passion is just really the sleep disturbed breathing, recognizing that nasal breathing is really the foundation for thriving health and vitality. And breastfeeding is a really important component of that through the impact on jaw development and tongue posture.
All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.